Welcome to U.S. Fencing Sports Medicine Podcast. I am Jeremy Summers, your host. Today we will be actually having a special guest from Mount Sinai Hospital in New York, Dr. David Putrino. We'll be discussing the most important aspects of understanding COVID-19 in regards to reintegration into sport. Dr. Putrino is a researcher, clinician, associate professor, and director of innovation at Mount Sinai Hospital in New York City. Putrino worked as a clinician in Australia before studying computational neuroscience at Harvard Medical School, MIT, and NYU. He's a former faculty member of the Weill Cornell Medicine and Burke Medical Research Institute. And finally, Dr. Putrino is an official medical provider for Red Bull sponsored athletes in North America. Dr. Putrino, thank you so much for joining us today.
Thanks for having me. It's great to be here virtually.
It is an honor to have you. Thank you so much. Before we jump in, I know that we've known each other for a few years. I've gotten to know a lot of your colleagues at Mount Sinai, Drs. Richard Chung and Dana McCarthy. They had a chance to work at a U.S. fencing event this last year. It was a pleasure to have them there. But the one thing that's really on my mind, and I probably on a lot of listeners' minds, is, you guys are on the front lines. I want to know how your life has changed being on the front lines during this pandemic as a clinician.
Things have definitely changed. We went through surge, sort of from March through to May, June. And everyone sort of dropped what they were doing and got involved in COVID management. Some of the doctors that you mentioned, Dana McCarthy was sort of coming in and working on the wards with very acutely ill individuals on a daily basis, as was Joe Herrera, and a lot of our sports medicine colleagues. I think it was a real crazy shift for most of us who never thought that we'd be working with such acutely ill people ever again in our careers. That it's just not what we do. But it was hard, but it was really incredible to see everyone come together as a team, everyone bond, and everyone just put their heads down and move toward a common goal, which is making sure that as many of our patients got home as possible.
Yeah, I reached out to Joe, Dr. Herrera, during the peak in New York City, and just wanted to check in. And he included me on some emails just to give me an update of things. And it was one of the most emotional things I've ever read. And I just want to thank you and all of your colleagues for what you guys had to do and what you're continuing to do for the community in New York and for patients across the country. And I know that I'm saying that not only for myself, but probably from the U.S. fencing family and the sports medicine family of the 25 sports medicine providers that we have working at our events. So we want to thank you guys.
Oh, we appreciate it. And the gratitude really does mean a lot.
Well, I think that we can jump into our conversation. I think this is a great topic, actually. U.S. Fencing sent out a email news alert a few weeks ago, maybe a month ago, about cardiovascular concerns following re-entry into sport. And I want to talk to you about this today. I think this is the most important thing. I know that you wear a lot of different hats in your job title, and you do a lot of different things for Mount Sinai, but what are you really focusing on now since the world is kind of doing what it's doing? Yeah,
so I mean, we're all COVID researchers now, right? It's that is kind of what has happened. As you mentioned, I do wear a bunch of different hats at Mount Sinai, and I actually run 3 different hybrid clinical and research centers at Mount Sinai. One of them is primarily concerned with sports performance, and so within my roles and responsibilities in that center, a lot of my work has now pivoted toward advising professional sporting teams on COVID policy. And then on the sort of, with the taking off that hat and putting on the hat of just the other clinical centers that I run, we're doing a lot of work. During surge, we were working on acute COVID management. And now, as many of our patients have started to just simply not get better, we've started to identify, explore, and try to understand what chronic COVID looks like, and how to manage that. So that has been largely what I'm concerned with at the moment.
So you're basically learning each day of long-term effects or potential long-term effects of COVID-19 currently.
Yeah, that's correct. And you know, we sort of, we're starting to bucket it into about three different, when we think about long-term COVID, we're going to bucket it into three different things. The first, not so relevant to most people, so I'll say it quick and get it out the way, is we're doing a lot to help manage what we call Pix Post Icu Syndrome. So this is individuals who got very, very unwell, ended up in the ICU on a ventilator. And as you might imagine, that is a really big shock to the system. And it often will take many months to recover from that. And so we want to make sure that they get the care that they need, that we don't sort of just lose them into the ether as they return home, but we actually do detailed follow-up and make sure that they're doing okay across the spectrum. And so we've been doing a lot of management with that. So that's bucket number one. Then the next bucket is the individuals with cardiovascular concerns. As you're aware, and as the world is becoming more and more aware, even individuals who are asymptomatic can sometimes sustain lung and heart damage. In addition, they can sustain damage to other organs as well. This is a multi-organ problem, and the reason why it's a multi-organ problem is because the way that COVID can manifest in many people is you contract the virus, your body mounts a very strong immune response to the virus. It releases compounds that we call cytokines, that are immune molecules, but it leads to a very strong release of cytokines. And sort of in medical slang, it's sometimes called cytokine storm, because your body just releases all of these cytokines in this very generalized and heavy immune response. Now, what that can do is kick your body into what we call a hypercoagulable state, meaning that your body starts clotting much more easily than it ordinarily does. And so this is why we're hearing stories of individuals who were COVID positive, but totally fine, and suddenly they got a deep vein thrombosis in their leg, or they got one of their kidneys shut down, or they had a heart attack, or they started to sustain heart damage. It is because even if you're fine, your immune response might be working overtime, and it might be moving you toward this hypercoagulable state. And so we've been seeing very funny multi-organ symptoms coming from these issues. And so then that's the second bucket I want to talk about, which is the group of individuals who had mild, sometimes nothing, like just barely anything symptoms. And then a few weeks after they've got their antibodies and they're walking around and they're fine, they're starting to realize, hey, I'm a bit short of breath, or I can't run as far as I used to, or I'm not feeling great. And when we run an echo, an EKG, a cardiac MRI, we start to see, oh, actually, while your body was getting over the virus, you actually sustained some organ damage. And working with those individuals is all about reconditioning and, getting them back to where they were pre-COVID. And of course, in more serious cases where there's pericarditis or endocarditis or myocarditis, so damage to the heart in various different forms, it's about getting them the intervention that they need so that they can be safe. And then there is a final group that has just started to be getting attention. This group actually came to my attention when we started, we were monitoring acute cases, and in around 10% of the acute cases, and these were mild to moderate symptoms, they did not require hospitalization. We were managing them from home with telemedicine. And around 10% of them just weren't getting better, but every test we ran on them was negative. So we did do all of the cardiac workup, and they didn't have cardiac damage. And we did a CT scan of their lungs, and they didn't have lung damage. And, you know, we ran every blood test we could think of, and nothing was showing up. What we're starting to see is that this is forming a post-COVID syndrome, that now we have collected data from around 91,000 individuals worldwide who are exhibiting these signs and symptoms. And the signs and symptoms look a lot like a number of different syndromes that are out there. So you may hear a number of different things being thrown around, like dysautonomia, chronic fatigue syndrome, mast cell activation syndrome. I don't like to put labels on what we're seeing right now because I think it's simply too early. But largely speaking, what we're seeing, the number one symptom is exercise intolerance. And when I say exercise intolerance, I mean you climb up a flight of stairs and you're done for 2 days afterwards. You know, so really intense post-exercise malaise and weakness and fatigue, and a real issue with the ability to tolerate your heart rate going up. We're also seeing dizziness, all sorts of GI disturbances, difficulty concentrating and cognitive fog, heart palpitations, high heart rate, numbness and tingling and pain down the arms, chest pain, fatigue, shortness of breath. And many patients will have all of these symptoms, or they'll have a constellation of these symptoms, and they will change day to day, week to week. So this has been a really challenging condition to treat. We have been working with that. You know, we're closely collaborating with the Center for Post-COVID Care at Mount Sinai to manage these patients. But one of the more striking elements of these patients is that around 30 to 40% of these individuals were previously fit and healthy. So these are individuals who are like, I shouldn't feel like this. I used to run marathons, or, you know, I run every day. I keep myself in really good shape. I'm a triathlete. And they're disproportionately being affected by this condition. So those are 3 buckets. Sorry, I went on for a bit.
No, I think you answered. That was invaluable information for our membership. I really appreciate that overview of your 3 buckets. We're going to focus on the second bucket, I think, for the rest of this time, because I think that's where a lot of our athletes fall in. I'm happy that you delineated between the 3, because that gives our, you know, our membership and our listeners something to ponder when they're you know, considering and getting back into sport, and they're already exercising. Maybe they've had COVID in the past, or maybe they've never been tested. And that's the thing that popped up in my head when you were talking is, you know, I have not been tested. I'm working out when I can, and those types of things. But you know, if I were to want to know, those are the types of things I might want to consider being tested in the future, just to know if I have the antibodies, if I've had it, and maybe potentially get screened. So I think that's very valuable information. Focusing on the second batch that you stated with cardiovascular concerns. So in May 2020, this 2020 in May, the AMA, the American Medical Association, and the JAMA Cardiology, as well as the British Journal of Sports Medicine, they all started coming out with recommendations of cardiovascular concerns and guidelines for athletes to get back into sport. I want to know, I guess I want our listeners to know what they're suggesting as potential long-term effects on the cardio. I know that you've said it already once. I want you to go over it one more time on the cardiovascular system and the heart, and why athletes should be concerned of this.
Yeah, absolutely. And so what we're seeing is that because of the propensity of this virus to sort of throw clots around and travel around to every organ in the body, you know, there's multi-organ involvement, but certainly there has been a lot of focus on the heart, because there are these conditions like myocarditis and pericarditis that can occur as a result of the viral infection. So myocarditis, again, to just sort of, break it down a little, it's simply a term, a general umbrella term for inflammation of the muscle of the heart. So something is causing this heart muscle to be inflamed. And what is concerning about myocarditis is that you can very often try to ignore or work through the symptoms that you're experiencing. So the symptoms can be very mild. They can just be chest pain, or you feel your heart beating up in your chest like when you're nervous. You might just feel a bit out of shape, like you're breathing harder than you usually do by walking some stairs, or or changing position, and you sort of will also notice that maybe your heart is beating a little bit faster than usual. However, the scary thing here is that if you ignore those signs and symptoms and you exercise, especially exercising, at the level that an elite athlete does on a regular basis, it can result in sudden cardiac failure. And so this is why, with all of the professional sports associations that we're working with, we're trying to be really, really cautious about basically treating everybody like they might have pericarditis or myocarditis, because those signs and symptoms, we all, have felt them, and especially right now, while we're sort of laying around in bed a little bit more, we're not keeping up with our exercise as much. It's more common to sort of like feel symptoms that seem like this and just poo-poo them and just be like, oh, well, I'm a little bit out of shape, or I'm not, doing what I used to do. I'll get back in the gym. I'll push it a little bit harder and it will be fine. We all need to just be a little bit more cautious right now, because that is, that is absolutely not the right thing to do, especially as we're learning more and more about how COVID can be asymptomatic. We're learning more and more, and this is really important, how a negative PCR test, so a negative test where they do the nasal swab, doesn't mean much in rolling out whether or not you have COVID, unless you have 3 or 4 back-to-back negative tests. The false negative rate on the PCR test is high. And so we need to make sure that if you're really going to get into competition or be around other athletes, 1 test isn't enough. I want 2, I want 3. We were working on some advising with the NFL. They wanted 4, and which I think is reasonable, given the false negative rate. If you're very early in the infection stage or very late in the infection stage. So with all of that uncertainty, I think that the simplest message is, if you're feeling any of those symptoms, heart palpitations, high heart rate, chest pain, increased shortness of breath, a little bit of a decreased exercise tolerance, just make sure that you let your coach, you let your doctor know, you get a cardiology workup, and you make sure that everything's okay, because it really is better safe than sorry.
I think that's a really good recap on the recommendations as far as what athletes can experience. And I think that's the biggest message we want to get across right now is, if you feel like you have been infected, you have tested positive, and you are having any signs and symptoms that were just explained, it's really important to get you see your physician and get a cardiac workup. I'm going to change my next question up a little bit. I know that you and I know athletes very well. We've worked with athletes for a long time, and a lot of them will say, well, I feel fine. I don't need to go get checked out. What is your answer to them?
Yep. My answer is no, not a single one of us has ever lived through something like this. So nothing that we do is business as usual. The assumption that we usually take in sports performance is, well, the athlete knows their body. we don't know our bodies in this case.
Okay.
Everything is new. We're all learning together, and this is an insidious virus. So really, if we're talking about performing at a high level and being able to consistently perform at a high level, it's just so important to make sure that you're taking care of yourself, you're doing the necessary things to make sure that you're screening for the virus, and you're not taking needless risk with who you're associating with, how much you're traveling, how much exposure, potential exposure that you're getting, because we don't know the course of this. We're already seeing cases of athletes just being knocked out for months and months and months because their symptoms aren't going away. And, you know, as an athlete, I think it's important that, sorry, not myself as an athlete, but sort of, you know, speaking to the athletes, I think that it is important that they strongly consider, like, the fact that all of the doctors are saying, we don't know what this could do for your career. We don't know how COVID-19 affects longevity of one's career. And, you know, as someone who's seen a few thousand cases now, please hear me when I'm advising extreme caution, because we're seeing a lot of long-term effects.
I appreciate that. My next question, that really answered it straightforward, so that's perfect. My next question is a little off path. I wanted to know about, you know, you said about the PCR test, the nasal swab test, and having, you know, multiple tests, which is really good information for our listeners to hear, I think, because you don't see that in the media as much. The next question is about the antibody test. When do you throw that into the mix, so we could inform everyone on that as well?
Yeah, so antibody tests are a hot topic right now as well. We know that antibodies fade. So within 2 or 3 months, the CDC actually just made a statement, you know, indicating that within 2 or 3 months, in many cases, you may, even if you had antibodies post-infection, your antibodies may have faded. Now, we do not know what this means in terms of immunity. It's simply too early to tell. Like, we have some really wonderful immune researchers at Mount Sinai, and their standard opinion, you know, their opinion of what is going on right now is, well, yeah, this is how the immune system works. You don't continue expressing these antibodies at high concentrations forever. They go into the memory T cells, and then if the virus comes back, the body knows how to fight the virus, and you don't even really get sick. You just sort of, your body handles it. So they're expressing, you know, no particular surprise that that the antibodies are fading, because that's how our immune system typically works. However, it is worth mentioning that many of the antibody tests, the way that they work is they look for levels of antibodies in your blood, and if you're below a certain level, they give you a negative result. So the reason I'm mentioning all of this is because a negative antibody result, again, does not necessarily mean you did not have the virus. It may mean that you're just so far, you know, past the symptomatic phase that your antibodies are no longer present, and easily detectable by the antibody test that you're taking.
Okay, that's great. That is great. I was wanting to, on the last two things I wanted to wrap this up with is, could you give me, let's say we're just do a scenario here. I'm an athlete. We could do a whole bunch of scenarios, but we'll just pick one. I'm an athlete. I don't know if I've had COVID. I was ill. I thought it was, you know, upper respiratory issues or allergies. But I'm not sure. And what should I do now? And how does a clinician work work me up when I go through the clinic? What tests do they do? How would they determine when to do those tests? If you could just do a quick algorithm for me, if that's
Yeah,
possible.
absolutely. I mean,
It's different for every case. Yeah, it's different for every.
yeah. And so, you know, we talked about the three buckets of long-term symptoms. And I think it's worth mentioning that, you know, around 70 to 80% of people who have COVID, they get sick, they feel unwell for about 2 weeks. In most cases, it's mild flu-like, and then it resolves, and then they're fine. You know, they don't feel anything other than that. So if you're an athlete and you're in that situation, if you're really, really curious, it's probably worth taking an antibody test and seeing what it shows up. But if you're not feeling any overt symptoms, keep on with your training, stay as healthy as possible, continue to socially distance, wear masks, do all of the risk mitigation strategies that you ordinarily would do, and we can go from there. If you are starting to feel some symptoms, and you know, the symptoms that I've been running down that list of chest pain, heart palpitations, you know, high heart rate, shortness of breath, issues with exertion. If you come to see one of our doctors who've been working closely with the Center for Post-COVID Care, the first thing that we're going to do is we're going to do a full cardiac workup, because we think about it in terms of risk management. And although it's a low probability that you're having cardiac issues, it's the most serious, you know, it's the most serious situation. So we want to make sure that we clear that right off the bat. Typically what we will do on that front is an EKG and an echocardiogram to make sure that that your electrical activity looks good and that your ejection fraction is looking good. There has been some rumblings coming out of the UK and recently published in British Medical Journal about heart MRI with contrast being built into that workup. We're looking into that and considering that as well. You know, we're sort of trying to balance the idea of making things approachable, affordable, scalable, and accessible for everybody. Because, you know, you don't want a situation where people don't go in and get a basic cardiac workup because they don't want to be on the hook for thousands of dollars. So, so we're trying to walk that delicate balance of what is enough to make sure that people are doing okay. And for right now, most of our cardiologists at the Center for Post-COVID Care, no, actually I shouldn't say most, I should say all, to be clear. The consensus right now is that an echo and an EKG are sufficient. And, you know, if symptoms persist that really point to a cardiac cause, then you can move into the MRI. But that is the initial workup that we go on. If everything is clear on that front, then we start to think about this third bucket, this sort of weird dysautonomia-like syndrome that we've been seeing. The intervention for that, well, the assessment for that is largely looking around what happens to your body when we put you through different changes of position. So what we're seeing largely in that group is we'll see a significant increase in heart rate and significant changes in blood pressure when people go from laying to sitting down, sitting to standing. And so that's one of the metrics that we're watching very closely in individuals to diagnose that. If people don't have those changes, but we're still seeing symptoms that are reminiscent of this, one of the things that we're doing is we're looking at CO2 levels and heart rate when we perform a test called the NASA 10-minute lean test. And often in the more finicky cases, that will bring out symptoms. So those are the tests that we're kind of working on right now in this moment. We're also putting out some experimental paradigms for assessment because we really want to get a nicer objective view of what's going on in our patients with these conditions. But I think that for right now, that's the best we got, and we're working with it.
Excellent. That's great information. As far as lab work, biomarkers, do you include that as well in the initial?
We've been looking. Right now, a striking sign is that all the labs are coming back clean.
Okay. I wanted to just ask about that and see what your response was on that. Well, that's really good information. I was wondering if we could just do a quick list of a summary from your point of view on for athletes out there that are listening to this podcast on a process of what they should do going down the system.
Well, I think first and foremost, I think we got to acknowledge that we're in uncharted waters. News is going to be changing all the time. So read a lot, watch the news, talk with your coaching staff, talk with your medical staff, and keep it just an open dialogue, open and honest, with the understanding, like, anyone who is telling you anything definitive right now is selling you something. There is no definitive right now. So just keep checking, and don't let your trust break in medical providers because the narrative is shifting. It is going to shift. This is a new condition. We're learning every day. So I think that's like right up the top of the list. The next is, we know that testing of both antibodies and PCR are unreliable in different ways. And so, the best thing that we can do right now is wear a mask, maintain good hand hygiene, socially distance, set a list of things that you need to do for your daily life, and rank them by risk. And then really think about it. Do I need to do this thing? Is it worth my career? Because I hate to be dramatic and I don't want to fearmonger, but with so many people popping up right now with really long-term symptoms, I think it's worth thinking about, especially, if you're an older athlete and you don't know how many more competitions you have left in you. These are things to consider. Like, can I come back from being knocked out for 6 to 8 months? And do I want to assume this risk? So I'm really all about behavioral changes in preventing unnecessary exposure to COVID, because it's the best we got right now. And so, even myself, and Dr. Herrera, and we were ruminating on this idea of, we were front lines for 10, 11 weeks, getting all sorts of exposure, but we were, relentless about lots of PPE, washing our hands, being, it was stripping down before we enter the house, leaving the house in our underwear, which looked really funny to our significant others. But like being very, very, fastidious about all of these things. And we were fortunate, all of us were fortunate enough not to contract COVID. And I think that really speaks to the fact that these measures work, and they're the best we have right now. So really making sure that the mask goes over your nose, you're not doing this, you're not doing that, it's not a chin strap, poking the nose out. That's a disaster. Don't do that. It doesn't work. May as well just walk around without a mask if you're going to do that. These are simple things, but it's like the one job that you can do right that will save you pain in the long run. And then, if the unthinkable happens and you do contract COVID, it's not the unthinkable. It's not the worst. Communicate closely with your medical staff. The worst thing you can do is hide things. The worst thing you can do is forget to mention, subtle symptoms that you're having. Everything matters right now because the disease is so new. So we need to be on top of everything as it occurs in real time. And so just, again, open dialogue with health professionals is super important.
Amazing. I think that really sums it up pretty well. I have one other thing I wanted to ask. I wanted to see if you have Any ideas for resources for our listeners to go to, as well as would you recommend them going to their primary care physician or to the American Medical Society of Sports Medicine to find a sports doc to work them up?
You know, it's funny. We have been, in terms of training people to manage patients with long-term symptoms, we've been having a lot of success with sports medicine docs and physiatrists, because they really, a lot of this feels, honestly, you know, again, I don't want to put labels on things, because, and this is certainly a wrong label, but a lot of this feels like a post-concussion like syndrome. And so sports medicine docs feel a lot more comfortable in being very patient-centric and being very symptom-centric in the way that they manage a complex patient. And this is nothing against PCPs. It's just that frankly, we've just been getting a lot of referrals from PCPs saying, we don't know what to do. These are a lot of diffuse, hard to characterize symptoms. And our sports medicine docs have been jumping in, and our physiatrists have been jumping in and saying, yep, got it. We've seen this sort of thing before and we know what to do. So I think that a sports medicine doc is a really good, a really good catcher for this sort of syndrome.
Excellent. I have one last thing. First, I just want to say thank you for your time and the invaluable information that you've given our listeners. I know that it makes me feel good inside that they're getting some of the information directly from the source. And I think that that's with what you guys are doing in New York. There's not that many centers like yours doing long-term COVID research, correct?
No, not right now. We're trying to change that, and we're getting out there and doing a lot of education around the country and around the world. But right now, there's just 1 or 2 in the country.
Oh, I can't thank you enough. As of right now, I just want you to know, and I've told you this in the past, you're officially invited to work with us at a U.S. fencing event. And I hope that we will see you in the near future and you're able to get away from your job there.
Yeah, me too. That would be amazing, and I'd be honored.
Thank you so much, David. I really appreciate it. Dr. Putrino, thank you again. We look forward to having you back on in the near future.
Fantastic. Thanks for having me.
Thank you.